Hello, Calaveras County. The doctor's in. I'm Mike Taylor, and I will guide you through this appointment with Dr. Randy Smart. Dr. Smart, good to see you.
Good to see you, Mike. Thanks for having me again.
Now, this time we're talking about something that I know next to nothing about, but I know that when you hear about it, it's always icky, and that's gout.
Gout.
What is gout?
So gout is probably one of the most painful and aggressive forms of arthritis that we know of. Mm-hmm. And it's basically related to body chemistry. And so your body does all these chemical reactions. It cleans things and filters things, and in that process with the body, there is a chemical called uric acid. Mm-hmm. And uric acid is a byproduct of metabolism. It is also produced by diet, and uric acid is then excreted by your kidneys.
Okay.
And so when levels of uric acid build up in the body, that's when the patient starts to have trouble with gout.
Okay. And how does that, well, I guess first, does that mean the kidneys aren't doing their job if the uric acid levels have gone up?
Right. So there can be a couple different reasons. The most common is the one you've just mentioned, is that the kidneys just aren't doing as much as they could do. There are some rare metabolic disorders that can cause this, but then there are also patients who have a lot of uric acid in their diet, and regardless of your kidneys, they can't keep up.
Oh, okay. What kind of foods bring uric acid to the table, so to speak?
Right. So this was a disease called the disease of kings.
Oh.
And the king of diseases. So it was called the disease of kings because the kings were the ones that suffered, and because it had to do with some rich diets and some indulgence, and we can talk about those diets. But the foods that were the rich foods and foods that the common people really didn't have access to were the problematic foods.
Okay.
So those foods include red meat, seafood, beer, other alcohol, pork in particular, fat, and that was pretty much the diet of the royalty not so long ago.
Royalty, right. You bet. That's right.
So those foods produced a lot of uric acid.
Okay.
And the kidneys couldn't keep up with that. And so as those uric acid levels went up, gout was produced. Now, what actually happens is uric acid is sort of dissolved in the blood or in the system, much like you would think like a powder, like something you're mixing a drink, it dissolves in there. But if those levels get too high, then the uric acid can't dissolve, and it becomes these crystals, these needle-like crystals, very sharp, very impressive under the microscope. And these crystals have a propensity to go to joints.
Okay.
And so when they go to the joints, that's where the problem starts.
It's like putting sandpaper in there, it sounds like.
Or worse.
Worse, okay.
Sandpaper would be a good day.
Oh, gosh, okay.
Or worse.
So how does a patient suddenly know they've got gout? Is it just joint pain, persistent joint pain, or?
So the usual course of gout, when we see most gout appointments, will be almost our first appointment in the morning. It'll be like 7:30 in the morning, 8 o'clock. It'll usually be a man. He'll usually be holding his shoe in one hand because he can't put it on.
Oh, my gosh.
And he'll be limping down the hallway. He'll look like he hasn't slept all night, and he'll be really angry.
Oh, man.
That's a gout patient.
Okay.
So what gout does initially It occurs more in men than women, although it'll occur in both. Men typically get gout in their 40s and 50s.
Okay.
And then on after that. Women tend to get it in their 60s and 70s.
Oh, okay.
And so across the board, probably 10 to 1 men to women get gout.
Wow, okay.
And so what these crystals do is they tend to go to the big toe. They go to the joint.
Really?
They go to the joint in the big toe. Absolutely. That's why he's holding his shoe. And so that the base of the big toe, that first big joint in the big toe, is 80% of the time where the arthritis starts.
Wow.
It's usually one joint. It's usually rapid onset within 12 hours. I mean, it doesn't take a week.
Okay.
It comes on in one day. Usually that actually comes on at night. So when people are sleeping, that's why it's that morning appointment, because he hasn't slept all night.
That's right.
And it is intensely painful. I've had patients tell me even the air hurts. Everything hurts. The sheets hurt.
Wow.
The socks hurt. But even the air hurts. So usually comes on at night. Usually men. Intense. Now, if you were to do nothing about that, that pain would last 1 to 2 weeks, gradually subside, and then there is complete resolution. And this is one of the hallmarks of gout, is it completely goes away, and you go, I'm cured, I'm fine, everything's great.
Until the next time you go to the king's house for dinner.
And it comes back, exactly, it comes back, right. So gout is often, and probably always really, Mike, recurrent. Now, some people will have a gout attack once a year. Some people will have them once a month. It depends on a lot of factors, but it is usually recurrent. And what we know is when somebody has one of these gout attacks, and we treat it and it all calms down, if we go back and examine that joint weeks or even months later when it's not so painful, we still find the gout crystals in it. And we still find the evidence of gout.
Really? And we don't know why it's not painful?
Well,
I mean, at that point? Because I would think that those sharp crystals would always cause a problem.
Probably fewer of them, and plus, by this point, they're often on medications that help.
Sure.
But the crystals tend to persist for a long, long time, and you can find them. So typically, the patient will have the red hot big toe without the sleep. It'll recur, but if nothing is done about that, then it can involve other joints.
Okay.
It can involve a knee, an ankle, a forefoot. Not very common in the hands, shoulders. I would say toes, knees, and ankles are the most common.
Maybe this is kind of a silly question, but are these crystals very heavy? Is this a gravity-related issue and they're sinking?
Not as far as I know. Not as far as I know.
Wow.
And why the big toe or why the knee, we don't know. But the hallmark is sort of one joint, red hot, completely goes away, and then it comes back. And if that's the history, that's almost 100% diagnostic. Not quite, but it's almost 100% diagnostic.
And so then what's done when I guess maybe this is a two-pronged question. Say it's someone's first time experiencing this kind of attack. Is the treatment for that the same as it would be for someone who presents and said, this is the second time in the past 3 months that I've had this kind of thing. I just kind of let it go the last time. So where do we go when we start to treat?
Right. So many people will seek attention on the first episode.
Because it's so painful?
Because it's so painful.
Okay.
And so we kind of approach gout with two strategies. One is the acute treatment for the painful toe and the guy that can't put his shoe on, and then is what do you do about it later? And so for the acute treatment, there are over-the-counter medicines that work.
Okay.
We've talked about them on the show in the past. One is Aleve, one is Advil. Those are called non-steroidal medicines.
Okay.
Or NSAIDs is another name. And those can be very effective at calming down the gout and stopping the reaction.
Is that because they reduce some of the? They're like inflammation reducers?
Exactly.
Just learning how to talk.
They're anti-inflammatories.
Anti-inflammatory. Okay.
And so in the world of anti-inflammatories, those medicines, Aleve and Advil, are a little bit wimpy.
Okay.
And there are better medicines. One would be indomethacin. That we prescribe in the office that really do the job. So the first line of therapy and getting the guy's shoe back on are these non-steroidal medicines like Aleve, Advil, or a prescription medicine.
Okay.
And then there is actually just a wonderful medicine out there that is a natural medicine called colchicine. And colchicine is an extract from a plant. And the plant is called, I think, autumn crocus.
Okay.
And it has this particular anti-gout, anti-inflammatory property. It's been around a long time. It is a prescription. But colchicine is very effective. And so if you were to come in this morning with gout, I would have put you on colchicine because I think it works better. And you would take 2, 3, 4 pills during the day, about an hour apart, and usually by tomorrow or the next day you can walk.
Oh, okay. So it's pretty quick.
So it'll work pretty quick. And then there are other medicines we can use for acute therapy. We can actually use steroids like prednisone. They work very well. Sometimes that's the exact right thing to do. We can use shots. There are shots of things we can do that'll help people. But the first thing we do is try to stop the acute attack and get the guy's shoe back on.
So does that mean you do something that's going to lower the uric acid level, or has the level already come down because those crystals have formed? And
yeah, the level really fluctuates, and that's a very interesting question because what we do is one of the first things we do is we measure the level of uric acid. Very common test. And that level fluctuates. It can be up and down and up and down. And so you can see somebody with an acute gout attack, measure their uric acid, and it actually be normal because it's come back down. And you go, well, it's probably not gout. Well, that would be a mistake. Because it can be normal and it can still be gout.
Sure.
And on the other hand, to make it a little more challenging, you can have a fairly high uric acid level and it'd be another problem. It'd not be gout. It could be something else. So measuring that can be helpful, but it's got to be done in context and it's got to be done by somebody who understands what they're doing.
Okay.
But it does fluctuate quite a bit. And so those medicines we talked about don't really lower uric acid. They actually interfere with the inflammatory process.
Oh, okay.
Now, lowering uric acid is part of the prevention.
And that would be basically diet?
Well, that is the cornerstone of preventing gout is diet.
Okay.
And so what we tell our patients with gout is you have to modify your diet. You have to get away from red meat, and in particular pork, bacon, pork chops.
Man, so far
Sound
I'm not
familiar?
having dinner anymore.
You have to back off on the alcohol, in particular beer and hoppy beer.
Oh, okay.
There's a lot of purines and nucleic acids in it, and you have to get away from high fructose corn syrup.
Oh, interesting. Okay.
Very interesting. I mean, high fructose corn syrup is something I think everybody should stay away from, whether they have gout or not.
I'll say it. It's poisoning us.
I think it is.
Without us
Right.
knowing it's going on.
I think it's contributing to diabetes, obesity, just a whole host of problems. But interestingly enough, there is credible evidence that it is also a trigger for gout.
Goodness gracious.
So one more reason to get away from high fructose corn syrup.
Yeah.
But that would be the first thing, is we would say, look, Mike, you have got to get a handle on your diet, and these are the things you need to stay away from. I think seafood in particular can be a problem, and those would be the shellfish like shrimp,
Okay.
lobster.
Again, you're going right to the
crab.
good stuff.
So Calaveras County, crab feeds. Right?
Oh, yeah.
Every organization in Calaveras County, I think, has a crab feed. Mm-hmm. And I want to go with my business card, and just start passing it out and say, tomorrow morning when you can't walk, I'm here to help.
Yeah, that's right. I'll be here to help.
Right. So the shellfish and the seafood are a significant problem.
Okay.
In some of our ethnic patients, for example, the Filipinos will eat a lot of organ meats.
Oh.
And it's part of their culture and part of what they do. But these organ meats, like liver and kidney and others, can be a particular problem.
Okay.
And if you can get those patients away from the organ meats, they can walk.
Are there foods that you can eat that we've covered, sort of the stuff to stay away from, but are there foods that you can eat that help your kidneys do their thing better and help regulate uric acid production? And
Great question. So number one is probably to stay better hydrated. If you're a gout patient, you probably should have a water bottle. I don't think everybody needs a water bottle and a straw.
Well, me and my kidney stones for a time needed the water bottle.
Right.
So.
But staying better hydrated in this situation would be a really good idea.
Okay.
It's also known that the low-fat dairy products really seem to do well with reducing gout flares, gout attacks.
Oh, okay.
So the low-fat yogurts, low-fat milk, those kinds of things would be what you would want to steer for.
Okay.
Certainly more vegetables, like all of us should do, more fiber. But it's basically getting a handle on the red meat and the alcohol.
Now, is this, when we talk about let's say red meat and pork, so we're talking about beef and pork, is this complete elimination of those, or, can you get away with a T-bone a couple times a month? That kind of thing.
You can. You can. If you were to see a rigid, strict rheumatologist, and this is the disease of rheumatologists, they would say no pork, no beef.
Don't go there, huh?
No shellfish. I don't think patients have to do that. I think they have to use judgment and cut back. Now, if they're eating bacon on weekends and they're still having attacks and their uric acid levels are still high, then they can't do that.
Yeah, and it's time to cut out the bacon.
But they could work with the doctor to find out what they can and can't have, and they'll find out. I mean, they'll know.
Sure.
But it doesn't have to be that you become a vegetarian. I don't think you need to do that.
Does it, and maybe I'm not quite understanding, but if I'm prone to these gout attacks, I eat that T-bone steak tonight, am I going to have a gout attack tomorrow morning? Is it that kind of thing?
It is that kind of thing.
Okay.
Yeah.
So so it's almost like bad heartburn or something like that. You didn't play by the rules, and now you're going to pay for it a little.
I went to the crab feed last night. I can't walk this morning. It's exactly like that.
Oh my gosh.
It doesn't show up a month later per se.
Yeah. So this is the kidneys being able to deal with that sudden influx of the uric acid that's coming in because of these foods.
Right, exactly.
Okay. Goodness. And so those crystals form that quick, go right to the big toe, and ruin your morning.
Oh man, they ruin your morning.
Goodness.
So if that's not really treated, then the joint can be destroyed over time. The joint can be damaged and destroyed. We've seen knees that were not functional knees, ankles, people who couldn't walk chronically. So the disease tends to become progressive. Ultimately, you can form kidney stones. You might have it. These are called uric acid kidney stones.
Okay.
And so gout patients can ultimately form stones. They're the same as other stones. They hurt and they move around and they cause problems. And ultimately, they develop these lumps that are full of uric acid. They're called tophi.
Oh.
And so they can develop these lumps on their fingers, actually on their ears, over their joints, over their kneecaps.
Goodness.
And if you examine these lumps or cut into them, the stuff in them is like toothpaste.
Oh, my goodness.
I mean, it squeezes out just like toothpaste. And that toothpaste is solid uric acid, all of it's uric acid.
Oh, wow.
In fact, I just saw a patient like this within the last couple of weeks, and he had lumps on his fingers. And I said, I know exactly what that is, and I know what we... Now, his reason for gout, people with underlying kidney problems, not really with a diet problem, but with a kidney problem, can have gout. So you could be a vegetarian with... His kidney problem is related to his high blood pressure.
Okay.
But it doesn't really matter what it's related to. If your kidneys aren't functioning normally for whatever reason, you can form uric acid deposits, gout, kidney stones. But these lumps can be pretty impressive. I mean, they can be the size of a grape.
Goodness gracious.
And if it's on a knee, it can be the size of a golf ball or a lemon.
Wow.
Yeah, it's impressive.
And will that form in the kind of overnight thing that we talked about, or is that a more long-term, the kidneys aren't keeping up?
Slower.
It's a little slower?
Yeah,
okay.
Slower, much slower.
So you're kind of going to chronically have gout, and then these will show up? Is that
right? You'll have the toe,
Tophi.
and you can't walk, and that'll start coming back at intervals, like once a month, maybe more often. And then you may have a toe and a knee. The knee bothers you, and that may come back at intervals, and you sort of motor through that. And then you may have a kidney stone, you may not, but then you may start forming some lumps on the helix of the ear, or on the fingers. And you may not have known ever that you had gout. You just know you had some joint pain, some arthritis, and you had to go to work every day. And but once we see those tophi, those lumps, we know that this is somebody who's had gout for a long time, and already has joint damage, and already is way behind the power curve.
Now, we're getting down to the last 3 or 4 minutes, but it seems like, in the discussions we've had, a good, huge percentage of the problems that the human body comes up against are diet-related.
That's true, Mike.
So it is garbage in, garbage out. It is basically what...
Well, you could even be a little broader. You could say that we do a lot of things that are not good for us.
Not good for us.
Whether it be tobacco or eating, diet, joint stress. I mean, we do a lot of things. And if we knew more about that, if the patients knew more about that, particularly at a young age, like 17, 18, 19, they could really improve their quality of life with some very easy and fundamental changes.
Sure, just making some really basic changes to their diet and sticking with them.
Exactly.
Yeah.
Yeah, exactly.
Okay,
That's
so I'm not
exactly
going to immediately give up bacon for breakfast. That'll be the last thing I give.
Of course. Of course.
Do you find that with something like gout that is so painful at the onset, are patients more compliant when you tell them they have to mess with their diet? Because I know a lot of us, as soon as you tell them you can't eat that, we think, oh my gosh, there's nothing that can replace that bacon with my morning eggs. So do patients understand and get the message?
There is nothing more motivating than pain.
Than pain.
Than pain. There is, I mean, you can have seizures, you can have heart attacks, you can have all kinds of problems. Maybe they comply, maybe they don't. 50% would be a good day. But if you have pain, man,
you're going to do what you can to make it stop.
Yes,
Yeah.
absolutely.
Okay.
Yeah.
So this one can be cured, basically, can't it?
This can be cured.
Yeah.
Absolutely. And,
Okay.
And even in the patient who needs a little more prevention, we have some very excellent medicines that'll lower those uric acid levels.
Until the diet has made its changes, or
even
do you
in
stay on
addition
those
to.
drugs? Okay.
In addition to. And they're inexpensive. They are prescription. An example would be allopurinol. But we have medicines that can really lower those levels. And once those patients are on that, they have great quality of life.
Okay. So this isn't a game mender. It's a game changer.
It is a game changer, right?
Yeah,
It is something you can do something about. Like all of our shows, Mike. This is something you can do something about.
Yeah.
And it's mainly recognizing what the problem is, why my toe hurts, and what do I do about it.
Well, basically what you're saying is don't go to every crab feed staged in the mother lode. Go to maybe one and call that your year.
Right. And let the others eat the crab.
Let the others eat the crab. You can enjoy the pasta.
You eat the potato salad.
That's right.
Exactly.
That's right.
Yeah.
Now, we're just down to the last minute or so. So basically, if your toe's killing you, but you ate like a king last night, you've probably got gout. You're going to go to the doctor because that pain has got to quit.
You'll go.
And then, you'll go. And then you're going to get that prescription that's maybe not necessarily go to the drugstore, but watch what you're doing at the grocery store.
That's exactly right.
Boy,
That is exactly right.
It's just astounding the number of things that are directly related to what we eat, and how devastating they can be.
And
when we overdo it, really,
right.
Thus the disease of kings.
And how effective it is to change that.
Yes.
So whatever the disease that we've talked about, if you change that, you can change the disease.
Boy, that's great. So you might not end up having to change your whole life, but you're definitely going to change dinner, ladies and gentlemen. So, and actually mostly gentlemen this time. But I want to thank Dr. Randy Smart for talking us through our pain and to the relief that we'll get for not going to so many crab feeds or eating so many barbecued steaks and pork chops. But we've got our gout under control. I'm Mike Taylor. The doctor has been in. We will see you next time. Thanks for joining us.